The gals from Bergstrom Eye and Laser Clinic are here with us today, and they have a new face to introduce us to. Welcome, first of all, Jill and Cassandra. We all know you, but we've got Megan with us.
Yay!
Welcome.
Thank you.
So brand new to Bergstrom Eye and Laser, but in the spa department,
Yep,
right?
Bergstrom Aesthetics is what we're calling ourselves now.
Bergstrom.
We're rebranding.
Rebranding.
Yes.
That's fantastic. So, of course, lots of excitement going on for you because you're new, you're getting to know new patients,
Yes.
but you're doing a lot there. So,
Yes.
before it was Dr. Bergstrom, he was the only injector,
Correct.
but now it's you.
Now it's me. That part of our practice has gotten so busy that he's kind of passed that off to me so he can focus on the eye side. He is still injecting, but primarily that's my position now. So Botox, Dysport, all the toxins, neurotoxins for wrinkles and fine lines, fillers, Sculptra, which is kind of like a filler, but replaces a lot of that facial volume that we lose as we age. And yeah, I'm helping out these girls here and there with lasers.
We
and
love it.
the
She's
skin stuff, but
amazing.
it's fun.
And you have a lot of history. I mean, you've got a lot of
do.
experience, I should
I do.
say.
I'm new to Bergstrom, but I'm not new to injecting. So a lot of people haven't heard of me yet, but I've had experience with plastic surgery, a couple of the
Okay.
top trainers in the United States, getting my certification in aesthetics soon, and yeah, I know what I'm doing, and it's fun, and I love it.
That's fantastic. She knows what she's doing,
She knows what
folks.
she's doing.
We're so lucky to have her because
Yes.
to have somebody who specializes just in injections is just huge. Somebody who actually, you have to be an artist besides just an
Oh,
injector.
right.
You know, you just don't want someone come in there and, you know, poking you. You need somebody who looks at your face and can see the different dimensions of your face, the different areas of your face that need it.
Right.
And we're so lucky to have her, so we're spoiled.
Very.
It's
and
fun.
she's touched both of us too.
Oh, yes.
And we're very picky, and she's done beautifully.
Yes.
We were so like,
Beautifully.
choose us, let's practice,
Right?
let's do some
Right?
stuff.
Can I get in on that?
Yes, yes.
Absolutely.
And a totally different experience. You're just not a number. She has her own room. You go in, you have a consult with her. She does everything for you, and you can discuss things that you want done with your face and what's important to you. And that's another difference. You're just not a number. You sit down with her, and she'll tell you what's best. Maybe you don't need so much. Maybe it's not your cheeks you want done. Maybe it's something else that you need done, and it's something different. It's wonderful.
Yep.
Right.
I take my time with you. We give you a full consult. We'll talk about what your options are, come up with a long-term plan if you need a few things done. And
Because, as we all know, skin, largest organ of your body, we need to take care of it, just like we take care of our hair, just like we take care of internally, our bodies. We need to take care of that skin. I think
Yes.
sometimes we forget to do that, and that's what we were talking about before Cassandra mentioned
We do.
to me. Don't
We
forget
do.
to take care of it.
Absolutely.
yes.
So, but what do you find people really come in, what is their number one concern with skincare?
Fine lines, wrinkles.
We wanna
As
stay
we age,
youthful.
we lose the fat pads in our face, our skin sags, and filler can correct a lot of that, and it can totally impact your life. I've seen people come in with poor self-esteem and leave completely changed. Their face is shining, they're smiling, because they get their cheeks back, they get their jawline back, they get rid of their jowls, and it's fun.
Yeah.
And it
totally-
shows in their
totally change your life.
personality.
Yep.
They leave her
Right.
room so happy and amazed that this could even be done.
And then we're poking our heads, and at the end, just like,
We're like,
Yeah, you
looking,
want to check it all out.
looking at it.
Oh, look at that.
And that's what I
Yeah.
do. Someone comes in to see me, and I see their potential, and I just pull that out of them with
she
the products
does
we
it
have.
the
It's fun.
right way. She
Okay.
doesn't overfill. Don't be scared.
Nope,
Right.
I won't
She
give you
does
Kim
so
Kardashian
well.
lips.
No.
Yeah,
most
we
of the
won't-
time.
Yeah, most of the time, unless that's what you want.
Right.
But most of the time, that's not what we want
No,
around
no,
here.
no.
So,
No, and we really pride ourselves on that, and you know that in our office anyway.
Very
So,
natural.
she did some gals yesterday that they were so beautiful that we're both taking pictures, and of course the clients were okay with that. But they
Yes.
turned out so beautiful, and again, it's artistry, and that's
is.
super important. The symmetry of your face, all of those things. So, and she does just a beautiful job.
because what do people also, okay, so fine lines and wrinkles, yes, but do people come in, they're talking about, maybe droopy eyes. That's a lot of things. Like my girlfriends and I, we've sat around and discussed, the fact that, the eyelids, they're kind of drooping, or maybe, sunken
Under eye circles, smoker lines,
things like
yep.
that. Oh yes, this as well, whether or not anybody's ever been a smoker, but you still call it that.
Right. Yep.
The wrinkles there. So are you seeing some of that too?
Yes, the under eye hollows, the jowls, and the smoker lines are probably our number one.
More so than
top 3
eyes?
complaints.
Yes.
Yep.
Okay.
Yep. sunken under
But
eyes,
then you
bags
can,
under the eyes.
don't you agree, you can chip your way at things. We can work at one issue at a time.
Yep.
Sure.
People feel overwhelmed right away too.
Yep.
And what's nice about having us both there is we
do-
can customize things. A lot of the things are skin, but then a lot of the other things are Megan.
Yep.
So we can come up with a customizable regimen
And just
for
to
you.
explain the difference
Yeah.
between you
She's
know,
primarily
Jill and Cassandra.
Yeah,
and
we're
Megan.
doing like the big lasers now that we have. Remember the
Sunspots,
sunspots,
redness.
You know, we knew our new oxygenail that you're going to have.
Right, I'm gonna test this out.
You
Can't
know,
wait.
so we're going to primarily do skin. But then what's nice is you get done with us, you're not having to. You go walk right next door to Megan if you have those issues that you want to discuss. And so you're all in the same building.
Right.
So it's more that boutique, intimate feel
Right.
than having to go from one clinical setting to another. And so we do all the fun lasers,
I love it.
all the good skin, and then we send you over for a little sparkle, a little sprinkle over next
That's
door.
cute. All right.
We make
Well,
a really good team because I can
We
change
do.
your face structure, but I can't change how your skin looks. And
Exactly.
That's what where these two shines.
A great
Absolutely.
team.
Yep.
Wonderful.
We love it.
Thank you so much for being and
you're
sharing,
welcome.
Megan, with all of us again. I know we weren't able to have you the last time, so we're very happy that you joined us today.
Thank you.
Nice to
Thank
be
you.
here.
All right. Coming up on today's show, celebrating our hometown hero, Roger Maris, with a collection of mugs that knocks it out of the park.